Medicare is in trouble. I'm one of the thousands of California doctors who are fighting to take care of elderly patients. In less than a month, devastating 25% cuts are scheduled to take place in the Medicare program. We doctors are extremely worried about this. We are concerned that we will not be able to continue to take care of our elderly patients. We need Congress to act.
If we see Congress this December simply not take action, if we get a 25 or 30% cut in December, January, these doors will close to new Medicare patients. We don't have a choice.
The issue is a flawed payment formula used to reimburse doctors treating Medicare patients. The payment formula is faulty because it fails to keep up with the rising cost to provide care to patients and run a medical practice.
The biggest problem, I think, is that the public has been so removed now for 20 to 30 years from what the real costs of medical care are. When we complain about Medicare reimbursement, the public thinks, the seniors think, you're getting a lot of money. Seniors are starting to smarten up. I get patients coming in here after they get their EOBs after a surgery and they go, I can't believe how little you got paid for that, doc. And I smile and I said, and that includes the next 90 days of your care.
When I moved to Sacramento in 1993, overhead was $12,000 a month. A year later, it was $14,000 a month. I went to the university for 11 years. When I came back, the overhead for a practice was between $35,000 and $45,000 a month. That's how much it costs to run the practice. That's the hard assets like the sponges and Q-tips and things like that, along with the personnel, along with the rent and the air conditioning. It's about $40,000 a month. If you can't bring that much in, then you're losing money. And there are a number of months, whole months, that are completely negative. If I got to pay my malpractice premium, that month is going to be in the negative.
Medicare patients are facing an imminent access to care crisis, not just in urban areas, but rural communities where specialized medical care is already scarce.
I moved to Redding in 1998 because there's nobody who does what I do between Sacramento, California, and Medford, Oregon. And there's nobody from the Nevada border to the Pacific Ocean, so I'm the only ophthalmic plastic surgeon for quite a wide swath of Americana. About November of this last year, the amount of money I was getting paid just wasn't covering my bills, despite the fact that 5 years ago I moved into this small 1,200 square foot office. I employ 3 people, 2 full-time, so I'm not a high overhead kind of a guy, but when Medicare pays you $380 to $410 to line an elderly patient up for surgery, do the surgery, do all the monsters amounts of paperwork that goes with it, and then take care of them for 3 months afterwards. And when it costs $300 an hour to run an office, it just doesn't work. I really worry that the populace of America is not really going to decide there's a problem until they can't find a doctor themselves.
Or just can't get in to see one.
If there was a reduction in payment for Medicare, I would still, because of the depth of the cuts, I would still have to cut personnel. And cutting personnel means cutting my nurse practitioner and her medical assistant. And that means cutting 3 days out of 5 of availability of 16 patients a day. So that's every week, 3 times 16 number of patients who aren't going to be able to be seen by a gynecologist, by a healthcare provider here in Folsom.
Throughout 2010, physicians of the California Medical Association have been making regular visits to congressional leaders in Washington. Maybe it's time those leaders paid a visit to physician practices here in California.
Come to my office for a week, not a day, but for a week. Come to my office, see what we do and how much it costs. Talk to my office manager and see what kind of money we're talking about passes through for the facility fees, for the pathology fees, for the how much little of that actually comes back to the physician. And then look at the faces of the patients. Talk to the patients for even 1 week about how they see the medical care that's being rendered to them and how hard it was for them to get there. And you will see why the solution has to be an evaluation of what it costs physicians to take care of patients and what their care is worth. And when you see that there are doctors out there saving lives and getting reimbursed nothing for it, time and time and time and time and time and time and time again, not just every now and then, But again and again, there are life-altering interactions undertaken that are completely unreimbursed. And when you see that and see the basic unfairness of that, you will come up with a solution that looks at what does it cost to get that kind of benefit and how can we make it work.
We urge you to call your congressmen, call your senators, and join with all of us in medicine and stop the cuts from taking effect. Care for our seniors is on the line. We need to do that.